Hello, NFU community, and welcome to today's webinar. Today, we are joined by one of our nephrology experts, Dr. Pranav Garimella. My name is Dr. Josh Gariboldi, and I am a medical science liaison here at Otsuka. I will be moderating today's discussion. We will be diving into the ADPKD Pain and Discomfort Scale, or ADPKD-PDS, the first validated tool for systematically assessing pain and discomfort in ADPKD. And with that, we'll go ahead and get started. So welcome, Dr. Garimella. So let's start us off with, why is it important to evaluate pain in patients with ADPKD?
Thank you so much for having me. Thank you for the question, Dr. Gariboldi. I think you've really set the stage excellently to discuss this topic. As you elucidated in the introduction, pain is a pretty common symptom in PKD. Almost 60% of people have it. And this really doesn't differentiate whether it is early in PKD or late in the stage of CKD. Pain can be present at any stage and is often one of the first diagnostic symptoms that people present with. Unfortunately, pain isn't systematically measured, neither in clinical practice nor in clinical trials, unfortunately. And there is a wealth of information suggesting that patient-reported outcome instruments that measure what's important to patients, what outcomes they're interested in, really need to be incorporated more into our clinical practice, especially in PKD. And when you look at surveys, patients with PKD and clinicians both agree that pain is underreported, is not systematically captured, and also needs to be described in the words of the patient rather than in the words of clinicians and researchers, as has been done. And as you can see on this slide here, it's not just the pain, but the consequences of it. Pain is often severe, persistent, it can flare, and it can be debilitating. And that has impacts on mental health and one's ability to perform activities of daily living. And so in order to accurately measure what the impact of pain is or what the burden of pain is, you really have to develop a tool to measure pain that is specific to PKD. As you can see on this slide here, nearly 18% of patients have PKD diagnosed for the first time when they experience pain. And one of the important things to consider is that not all pain is the same. So musculoskeletal back pain, for instance, could be very different from pain due to a kidney stone or a urinary tract infection, or due to cyst rupture. And that's why it's important to understand pain domains and pain phenotypes that occur in PKD specifically. And unlike many other kidney disease states where symptoms manifest much later, pain can actually happen quite early in patients with PKD. And as a result, the 2021 Polycystic Kidney Disease Regulatory Summit identified pain as a core outcome for PKD research. Similarly, the standardization of outcomes in nephrology group, the SONG group, also identified patient-reported outcomes in pain in PKD to be a priority. And so all this kind of led to the development of a PKD-specific pain and discomfort scale, which we'll talk about in the webinar today.
Thank you, Dr. Garimella. So you gave us a nice background of why it's important to assess pain in ADPKD and the different types of pain that's experienced by patients and how each patient experiences their pain differently. Thank you, Dr. Garimella. Thank you for that great overview of the process, how both the qualitative and quantitative process of developing this ADPKD pain and discomfort scale. Can you talk a little bit about, more specifically, these three distinct pain types that were identified?
Absolutely. This slide kind of highlights those three pain types identified. One is the sharp pain, two, the dull pain, and three is this general sensation of fullness or discomfort. And these are direct patient quotes taken from the development phase of the questionnaires. And when clinicians think about sharp pain, it's usually associated with infection, a cyst rupture, sometimes even a kidney stone. And the description of that in the first box is exactly how it sounds like when someone says that, I felt like someone was putting a knife through me. And thankfully, as you will see in the results, this isn't very common in patients with PKD. It happens quite a lot, but in comparison to the dull pain and the sensation of discomfort, it's thankfully less common. Probably the most common complaints from patients about pain is that it's always present. It's a dull pain. Sometimes it moves from the flanks. Sometimes one side is worse than the others. The sensation of fullness and discomfort actually can present in several different ways. I've had patients report to me that they just can't eat as much. They feel bloated after a meal because of the sensation of fullness. I've had patients tell me that they feel like they're pregnant again and they can't wear, their coats, or it feels like they're wearing a tight waistband, etc. So, in the validation of the PDS as well, you will see that these concepts carry forward, and we've kind of have more granular data on how they relate with kidney function and the severity and frequency of each of these types of pain. And on this side, we see the prevalence really of each of these pain domains and how they have impacted patients. So on the top part here, we see sharp kidney pain. And as you can see, about 42% have reported having sharp kidney pain. Dull kidney pain seems to be slightly less frequent, but you can see that it does impact sleep disturbances. Nearly 17% said that they were either irritable or had sleep disturbances. 20% say that their pain impacted relationships with other people. And nearly 28% have reported taking some kind of pain medication to manage the dull pain. And so just goes to show you that dull pain plays an important role in affecting people's lives and their mental health. And even if you look at the fullness and discomfort, if you look at the inability to eat or loss of appetite, nearly 15% have this. And nearly 18% say that it impacts moderate physical activity. And like you can see here at the bottom bar, nearly 36% have some form of fullness or discomfort. So again, just showing you that anywhere from a quarter to over 40% of patients with PKD have some form of pain, whichever domain you pick, and that there is a significant impact of each of these on the quality of life and the ability to perform daily activities.
Thank you, Dr. Garimella, for breaking down the types of pain that were identified in this qualitative phase, the specifics that we picked up in these focus groups, and then obviously we had the quantitative phase. And then now what we're looking at is this final version of the pain and discomfort scale. Can you talk a little bit more about that?
Absolutely. So as you can see here, this is a screenshot of the 20-item pain and discomfort scale that was sent out to participants via the online survey. And over the next few slides, we'll talk a little bit more about how each of these responses relates to the degree of kidney function and how they affect the patient's ability to conduct activities of daily living.